In this video we are going to talk about aspirin poisoning, so let's start. The main features of salicylate poisoning are hyperventilation, tinnitus, deafness, vasodilation, sweating. Coma is uncommon but indicates very severe poisoning. The associated acid-base disturbances are complex. Generally, the clinical severity of poisoning is less below a plasma salicylate concentration of 500 mg liter, 3.6 mmol liter, unless there is evidence of metabolic acidosis. Treatment of aspirin poisoning. So activated charcoal can be given within 1 hour of ingesting more than 125 mg per kilogram of aspirin. Fluid losses should be replaced and intravenous sodium bicarbonate may be given, ensuring plasma potassium concentration is within the reference range to enhance urinary salicylate excretion. Optimum urinary pH 7.5 to 8.5. Plasma potassium concentration should be corrected before giving sodium bicarbonate as hypokalemia may complicate alkalinization of the urine. Hemodialysis is the treatment of choice for severe salicylate poisoning and should be considered when the plasma salicylate concentration exceeds 700 mg liter, 5.1 mmol liter, or in the presence of severe metabolic acidosis. To stay up to date, make sure to subscribe to our channel. Thank you.